with Families Helping Families of Southwest Louisiana as the community resource specialist. A few things to take note of as we begin this morning. The webinar is being recorded, as I'm sure you just saw. You're going to receive a copy of today's PowerPoint in the next day or two. We'll ask you, if you don't mind, to add questions you might have to the chat as we go along, and we'll answer those at the end. For the purposes of sound quality, everyone is muted for the webinar today. And lastly, you're going to be prompted to complete a post-event survey with the presentation is complete. Wallace has already put that in the chat for you. If you'll take care of that for us, you can open it now and then finish it when the webinar is over. And then if you miss it by chance, we'll send a link to the survey for the survey to your email when this is over. So those surveys are important to us. Wallace is going to probably, if I know Wallace well enough, he's going to be adding resources to the chat. So know that that's there for you. Ordinarily, I have someone from our office talk about LACAN, but I'm going to take care of that today. Most people that I see on the webinar, I know, and you're familiar with LACAN, but for those of you who aren't, LACAN is Louisiana Council's advocacy network, and it's a statewide grassroots advocacy network. It links lawmakers and individuals with disabilities and family members to make positive change in systems serving people with disabilities, particularly home and community-based services and inclusive education. Every year, LACAN puts together a list with feedback from the stakeholders on that issues that they want to tackle on a legislative level. And all of that is to promote better lives and communities for people with disabilities. What I would say is, if you're in Louisiana, be on the lookout for meetings. There will be meetings scheduled in each of the regions to collect input for things that can be changed on a legislative level to benefit people with disabilities and their family members, where it concerns, again, home and community-based services and education, particularly inclusive education. There were some wins this particular legislative session as a result of the efforts, grassroots efforts of LACAN. Some of those were funding for Louisiana post-secondary inclusive education. The work that LACAN did also contributed to incontinence supplies being provided by waivers for adults. That work is ongoing. That's not currently entirely figured out right now, but because of the work of LACAN, that's something that's going to happen. It's free to sign up. When you sign up, you're basically agreeing to develop relationships with your lawmakers. And that's something that we should be doing anyway, as constituents of theirs, as family members, as people with disabilities. And so the commitment is a couple of emails. It is relationship building. It is maybe sharing your testimony at the Capitol. And it might also look like a trip to the Capitol if you're able. None of that is mandatory. Basically, what you're agreeing to when you sign up is to get the emails and receive that correspondence, and then make decisions about how you want to contribute for you personally. Okay, so moving on, I want to give you a little bit of background about this particular training. The training was originally put together over a decade ago by Michaela Burt. She worked here at Families Helping Families of Southwest Louisiana. It's since been updated by Monica Stampley. She's a coworker of mine in Region 7. She did a lot of work to get this up to date. Much of Monica's work was used, but regional updates were made so that the training would be relevant to this particular region of the state. The information is really meant to get families started by giving them an overview of what is available regionally and then also on a state level. So we're going to go ahead and get started. Wallace, I appreciate how responsive you've been to changing slides. We're moving on. So first is Early Steps. Early Steps is Louisiana's early intervention program for children ages birth to 3 who have developmental delays or disabilities likely to result in delays. For children who qualify, those services are going to be provided in the home or natural environment. The services provided by Early Steps will educate the families on how to work with their child to help them meet their developmental milestones. So a professional comes in and works with both the child and the family. And depending on what the needs are, kind of determines who's going to be going into the home. Next, on the slide, you're going to find important contacts if you're receiving or interested in receiving Early Step services. Starting from the bottom, China Guillory is in our Families Helping Families office here. She's a parent contact for families and providers. Moving up the list is Patrick Juneau, who is our regional coordinator for this particular area. If you think you need him for any reason, you can contact China. But most questions a family is going to have are likely going to be handled by China or a family support coordinator. And families are mostly familiar with that person by the term FSC. The Early Steps SPO, or the system point of entry for this area of the state, is in New Iberia, and they can be reached at the number on this slide. And again, you'll get this slide deck for participating today. You'll receive it in your email. Next slide. So resources that are offered, there are certain resources that will be offered during the intake process with Early Steps. Medicaid, which is otherwise known as Healthy Louisiana, Children's Special Health Services, Imperial Calcasieu Human Services Authority. We refer to them a lot of times by MCAL, and then the Medicaid Waiver Registry. I'm going to provide a bit more detail about these in the next few slides. Next slide, please. Thanks, Wallace. Healthy Louisiana is Medicaid's managed care in our state. In the past, you may have heard Medicaid called Bayou Health, KidMed, or Community Care. When you become eligible for Healthy Louisiana, you're going to choose your own health and dental plan. You can choose an additional plan for family members receiving behavioral health services as well. Each member of your family receiving Medicaid will have their own individual plan too. Currently, there are 6 Healthy Louisiana plans to choose from. There's Aetna, AmeriHealth Caritas, Healthy Blue, Humana, Louisiana Healthcare Connections, and United Healthcare. What plan you have matters because some doctors take some plans while others take other plans. Something to keep in mind with Medicaid's managed care plans is that open enrollment happens every year. Open enrollment is the time during the year when you can change your healthcare plan. It looked different this last year because a new health plan was added, but open enrollment is generally in the last few months of the year, and that's something to look to. Next slide, please. So the Medicaid Family Opportunity Act, or FOA, is healthcare coverage or Medicaid buy-in for uninsured or underinsured children with disabilities whose families have too much income to qualify for Medicaid or LCHIP. The qualifications for Family Opportunity Act are listed here in the right side of the slide. When you receive the PowerPoint, if you click on the Medicaid Family Opportunity Act title at the top left corner of this page, it will take you to the Family Opportunity Act page on the Louisiana Department of Health's website. There, you're going to find a link to apply and a section that provides contact information in case you have any questions. This slide deck is really meant to be interactive for you when you receive it, so just know that you'll have access to that when we're finished. Next slide, please. So this is super exciting. Act 421 is also known as Children's Medicaid Option, or CMO. Another name that it might go by is TEFRA, which is another acronym. It's relatively new as of 2022. This program provides Medicaid eligibility to children under the age of 19 who have disabilities and meet the institutional level of care, regardless of parental income and resources. This is huge for families that have members with disabilities. Next slide, please. Listed on the right-hand side of the page are the eligibility requirements for Act 421, CMO, or TEFRA. Again, clicking the link, the title on the left corner of the page will get you to the Act 421 website. So I really don't want to read these slides to you, but because this eligibility is very specific, I'm going to go ahead and read those requirements if that's okay. So you have to be a Louisiana resident. You have to be a United States citizen or qualified non-citizen, under the age of 19, not to exceed the age of 18. You have to have a disability that is recognized under the definition of disability utilized in the Supplemental Security Income Program of the Social Security Administration, regardless of whether the child is eligible to receive benefits under that program. I know that's a mouthful, but you would have to qualify for Social Security by disability, even if you don't receive benefits. Excluding the assets or the resources of the parents, the child does not have a total asset resource exceeding $2,000 in value. Excluding the income of the parents, the child's income is less than 3 times the federal benefit rate, or FBR, referred to as the individual specific income limit, or SIL. The child meets an institutional level of care provided in a hospital, skilled nursing facility, or intermediate care facility, or an ICF, and then care provided safely at home for less than the cost of institutional care. It's a lot of specifics, but you can get more information on the website, and you can call our office too. So on the next slide, listed below are the steps enrolling in Act 421. Once the first step is completed, you'll move to the next in the process. If your family is determined to meet the level of care in step 2, you'll move to step 3. Likewise, if the applicant is determined to have a disability that meets the requirements, you'll then move to step 4. Step 1 is to complete a Medicaid application. You can find more information about enrollment on the website. Important to note, though, is that there is a step in the process when completing the application where you must select a health plan. If you do not choose a health plan, a plan is randomly assigned. Also important to note, when applying online, you must place a check in the box next to the applicant that has a disability on the additional personal details screen. This information is on the website. I know it's very detailed, but it's also important, but you can see it on the website too. When using a paper application and the disability question is question 12 and needs to be answered yes. So in step 2, families will receive a level of care packet to complete and send to Medicaid. Completed packets can be faxed, emailed, mailed, or documents can be uploaded directly to your Medicaid account. So that's pretty user-friendly. Step 3 is disability determination. Applicants must meet the definition of disability as set forth by the Social Security Administration. Medicaid will request a disability decision from the Medical Eligibility Determination Team, or the MEDT, for applicants that do not have a disability determination with the Social Security Administration office. MEDT may need additional documentation in order to reach a decision on the disability determination. Step 4, the enrollment service coverage through a Healthy Louisiana plan. When completing a Medicaid application, you can choose a Healthy Louisiana plan and dental plan. We talked about that a little earlier. If you've not selected a health plan, enrollment in a health plan is automatic upon enrollment in Medicaid. The family will have 90 days from the date of enrollment to change plans when automatic enrollment occurs. So you will be automatically enrolled, which could be a problem if, for instance, your primary care doctor doesn't take the plan you're enrolled in, but you will have time to make your own decision and change that 90 days. So next slide. Children's Special Health Services, or CSHS, is specialty health care for kids with certain disabilities. To be eligible for CSHS, you must live in Louisiana, be less than 21 years old, have a health problem covered by CSHS, and have Medicaid. Next slide, please. CSHS covers direct healthcare services in the Children's Special Health Services clinics. So also care coordination, youth health transition, and developmental screening. Next slide. This slide includes information about Children's Special Health Services in this region. There are services offered in other regions of the state, and you would have to contact them for more information or visit the website. But currently there are 4 clinics offered out of the Calcasieu Parish Health Unit: audiology, genetics, neurology, and otology. For more information about clinics and eligibility, you can call me here at Families Helping Families, or you can call the health unit at the number on the slide. Next slide, please. So after a child ages out of early steps, there are several transition options. A child may qualify for services with the school system. They might also attend Head Start or go to daycare. They can attend a preschool or an ABA program. The child's family may also qualify for and access services with Imperial Calcasieu Human Services Authority, the Developmental Disabilities Division specifically. Next slide. Next, we're going to talk about Imperial Calcasieu Human Services Authority. In our office, we often refer to them as MCAL. Next slide, please. MCAL has two divisions, the Developmental Disabilities Division, and I know this is a busy slide, but I may explain some of it to you. They also have the Behavioral Health Division. The Developmental Disabilities Division is the single point of entry for those who have developmental disabilities with onset prior to age 22. They provide multiple services, individual and family support, support coordination, supported living, transition services, waiver services, like we mentioned earlier, flexible family fund, residential services, and EPSDT. You can find additional information on their website or by calling their office. When you call, it's going to prompt you to select either the Developmental Disabilities Division or the Behavioral Health Division, and you'll select Developmental Disabilities Division if you're calling about the services that I mentioned a moment ago, waiver and those things. Imperial Calcasieu Behavioral Health has multiple clinic offices across the region. Those are listed on the right-hand side of the slide. Fees are assessed according to a sliding fee scale based on income and number of dependents. There may be a charge for urine screens or copayment fees. They do accept Medicaid, Medicare, private insurance. Payment plans are available for those with the ability to pay, and the office can assist with determining your cost or fee plan. Next slide, please. So moving on, we're going to discuss some additional resources. Families Helping Families of Southwest Louisiana has partnered with the Social Security Administration Public Affairs Specialists. If you'll move to the next slide, Wallace, thank you. We've done that in our region to offer Social Security for people with disability webinars. Other regions of the state have done the same. Those have been recorded and are on our YouTube channel for you to use as a resource. Look under videos. Our YouTube channel can be found at the address on the slide or by searching FHFSWLA. We've actually had a couple recorded and on our site to go back and reference, but there's some information on this slide that will tell you a little bit more about supplemental security income. Next slide, please. The following programs are currently offered through the Department of Child and Family Services. Supplemental Nutrition Assistance Program, otherwise known as SNAP, and formerly known as food stamps. The Family Independence Temporary Assistance Program, or FITAP, which is it provides temporary cash assistance to eligible low-income families who need assistance for children. Also, the Kinship Care Subsidy Program, which provides cash assistance for eligible children who reside with qualified relatives other than parents. And then what most of us are familiar with, the Child Support Enforcement Services. I'm not intimately acquainted with the services that they offer, but you can always call our office. Someone may know, and then you can also visit their website to get additional information. So next, the Child Care Assistance Program, or CCAP, is a resource available to families that can provide financial assistance to low-income families that assist with daycare. More information for that program can be found on the Louisiana Department of Education website, and that's where you'd actually apply for services. Okay, next slide. So these last 5 pages are going to cover resources by parish. So they're kind of individualized to Region 5, but you'll receive a copy of this PowerPoint for attending the webinar. And you should be able to click the links in the PowerPoint when you receive it, but you can always call us with any questions you might have. So in Allen Parish, we've listed a contact for special education services because a lot of families we speak to do utilize those services. Early childhood, the Allen Parish Health Unit, the Council on Aging, and then the housing authorities in Kinder and Oakdale. The next slide covers some resources in Beauregard Parish, the special education services, early childhood, the health unit, the Council on Aging, and then DeRidder Housing Authority. And if you know specifically that one of these resources is not, we did update this very recently, but if you know that it's not active any longer, please just feel free to let us know. We'll make sure that gets updated. So in Cameron Parish is a little smaller. There aren't as many resources there, but we did list the school board special education contact, the early childhood contact, the health unit information, and the Council on Aging information. In Calcasieu, and there are more resources than what we've listed, but to kind of keep with the same pattern, we have the special education contact, early childhood special services, the health unit where you can receive special children's special health services there, and then the cell phone number as well, the Council on Aging, and the Lake Charles Housing Authority. And then last is Jeff Davis. So we have, again, the special education services contact, Ready Start, which is their early childhood, the health unit, the Council on Aging, and the Jennings Housing Authority. So last, but certainly not least, Families Helping Families of Southwest Louisiana. We're a statewide network. There are 9 other offices like ours across the state. But Families Helping Families of Southwest Louisiana really is a one-stop shop for people who love and care about people with disabilities. We do this work because it's personal for us. Our mission is to enable and empower individuals with disabilities and their families, and we do that by providing information, referral, education, training, peer support, and advocacy skills. We got through that rather quickly, much faster than I expected to. So if you have any questions for us, please put those in the chat. If you have any feedback, you're welcome to include that as well. I again want to thank you for being here and want to encourage you to fill out our post-event survey. I apologize again for the technical issues that we encountered, but if you'll take care of that and tell us what other webinars you might be interested in. These trainings are free opportunities to gain knowledge and learn about new resources in and around our community. And we definitely want to provide those resources to our community. Let's see. It sounds like we weren't the only ones that had tech issues. So I sure hate to hear that. Miss Melinda, we did briefly share about LeCan, but seeing as though we have quite a bit of time, if you'd like to maybe give like a review or maybe even advertise for the upcoming meetings that are going to be held to collect information to plan for the next legislative year, you're welcome to do that.
Thank you so much, Javelin.
Yes, ma'am.
Nothing aggravates me more than to have done something 1,000,000 times on Zoom and try to do it this time and Zoom won't work. So I'm going to have to go back and work on my phone to see what I can figure out. But it's just the way technology is, I'm guessing. At least it happens often enough. That must be true, right? Let's see. So we've had a pretty successful session. Y'all might have already covered this, but before the session even began, LDH agreed. They sent us a letter of intent that they were going to include incontinence supplies in the home and community-based waivers, like the NOW waiver, the ROW waiver, and the supports waiver. It was actually the only waiver in Louisiana that did not have incontinence supplies included. So I figured that LDH thought, that this was an anomaly, that it wasn't covered, that they just needed to do it. But that was good. That was an early win. It was a difficult session. It was complicated. It's still complicated. If you keep track of what's going on, there are massive cuts to LDH. Luckily, it wasn't cuts to home and community-based services. One of the things that we worked on was resources for people with developmental disabilities that wanted to go to post-secondary education, some kind of college education. Some of the universities in the state have them, a handful. And there's a handful of people that can go, and some don't but would like to. As with any program, especially a university program, it's expensive to start up. People don't get Pell Grants in the beginning in programs like this. It's something that comes with time after they get certification. So the startup costs is one of the things that this fund that LaPie has will help universities with. Expansion. We had hoped to get $3 million. We only got $1 million, but in all honesty, at the very last couple of weeks of the session, I was glad we got $1 million. I feel like that's a real win. What else? Oh, funding for families helping families. The last couple of years, we were able to receive $500,000-ish for 9 centers, basically to keep the doors open. The prices of everything have gone up so much, at our houses and at our Families Helping Families offices too. We were hoping to get it added into the continuing budget. We weren't successful with that part, but again, considering in the last 2 weeks of the session, it didn't look like we were going to be able to receive the money again this coming fiscal year. I'm still considering it a win. And in all honesty, I hope we're going to go back next year. The final thing was virtual meetings. Almost all virtual meetings that I can think of, except maybe 1 or 2, had shut down. Meaningful participation in the meeting. Yes, many of them you could still watch on YouTube, but the YouTube chat or comments wasn't considered or read into the into what was going on. We worked with Senator Hewitt, come up with a bill that still basically made meetings in person, except for meetings for people that either had disabilities or were caregivers of people with disabilities. It's not enough. Yeah, it's great to be able to watch it, but since COVID and we've learned different, it's not enough to just be able to watch it. We want to be able to have a say in things that are going on with us. And some parents of children with specific kinds of disabilities, they just can't up and leave like that. Again, it had been working its way through session, looked good, still looked good at the end, and passed. The governor signed that one, by the way. So the virtual meetings and the money for the post-secondary programs were bills of their own, and the governor signed them. Our money is considered part of the budget, and to my knowledge, at least up until a day or 2 ago, the governor hadn't signed a budget. There was the budget as a whole. There was conversation about these massive cuts to LDH, and he has line item veto. So we have no reason to believe the Families Helping Families money is in any jeopardy whatsoever, but it's not going to have a signing like the other 2 had because they were their own bills. That's a nice little piece of information to know where different asks are in the legislative process and how it gets to be part of law or not. And I think I used up all your extra time. Anybody have any questions?
Thank you so much, Miss Melinda. You do a much better job of summarizing those things because of your intimate knowledge of it. I really appreciate it. I'll remind you again, be on the lookout. Miss Melinda is going to host multiple meetings giving families and heck, any invested person the opportunity to say, this is what I want worked on. This is what needs to change. It doesn't mean that your item is going to be what goes, what is part of the LACAN agenda, but it'll be considered and it'll be brought up. So please look for those meetings, participate in those meetings. Those are important because we need to know what impacts families. And then we need people to follow through with bringing that information to their legislators and their senators and to the Capitol in some cases. So again, Wallace is working on our survey. Our link appears to have been broken, par for the course this morning. I apologize if I ran through that information faster than was digestible. But again, we're going to send this PowerPoint out to you. If the survey link is not working prior to the end of the webinar, it's going to go out in an email to you as well. So again, if you'll fill that out for us, it's important to know that we're getting information to you that is useful. And we, again, want your feedback as well about other information that we can present. I'll give you back some time today. And if you'll look for the email with the survey link and look for this PowerPoint and provide us some feedback on that, that would be great. We're going to stay on for a few minutes. If you have any questions or anything like that, please just let us know. But thank you again for joining us today and for your patience with the hiccups. Have a great day. Don't hesitate to call our office if you need anything. Thank you so much.